Good day and welcome to the lecture on the introduction of kidney cancer. I am a cancer researcher at the Institute for Personalized Oncology. I am section of First Moscow Medical University in Moscow. I'm also the principal investigator at the Royal Society of Clinical and Academic Researchers, Roscar International. I'm Abba Moses Owoicho Melchizedek. By the end of this lecture, you should be able to understand what kidney cancer is all about, the types of kidney cancers, the symptoms associated with kidney cancer, what varicocele is equally all about, the classification of kidney cancer, the causes of kidney cancers, the recommended therapies, and an overview of the most predominant types of kidney cancer out there. Please kindly do me a favor by hitting the subscribe and like buttons, and also do well to share this video to your fellow loved ones, fellow students, research team members, cancer patients, caregivers, and clinicians as well. Thank you as you do that. Now, what is kidney cancer? Kidney cancer is simply the uncontrolled growth of kidney cells that result in the formation of tumors in kidneys, which often result in kidney failure owing to other complications. Kidney cancer is characterized by abnormal cell growth in the kidneys. It can result in both benign and malignant tumor, meaning it can either remain in a specific location, which is referred to as benign, or better still, spread to different organs such as the lungs, liver, and bones, which is often referred to as metastasis. So in the nutshell, metastasis is simply the translocation, or better still, the movement of cancer cells from one part of the body to another, okay? Although the spread of kidney cancer to lymph nodes is associated with poor prognosis, which is often seen as poor response of patients to treatment. Meaning, when there is a metastasis of kidney cancer to the lymph nodes, it is an indication, it is a sign that the patient is not recuperating as he or she is supposed to be. Yeah, so the clinician, it behooves on the clinicians at that material time to switch therapeutic, the therapeutic strategies that is being currently used on the patient. So it's very, very important. So when there is a metastasis of kidney cancer to the lymph nodes, it signals a poor response of patients to treatment therapy. Yeah. So although the spread of kidney cancer to lymph nodes is associated with poor prognosis, which is often seen as poor response of patients to treatment strategy. Like I said earlier, research shows that advancements in a treatment like immunotherapy precisely, it offers hope for longer survival rate of patients. While routine early detection methods are not yet available for kidney cancer, individuals with family history of kidney cancer can undergo tests like the computed tomography, such as this, which is basically CT scan, yeah, CT scans, or renal ultrasounds to identify potential symptoms, and then seek timely and appropriate treatment. Uh, treatment, yeah. So, what are the types of kidney cancers? What are the types of kidney cancers? The knowledge of kidney cancer cell types is very, very, very crucial for determining the most effective treatment strategies for patients. There are over 40 types of cells that are involved in kidney cancer pathogenesis, which include renal clear cell carcinoma, with clear cell and papillary cell carcinoma as the most predominant subtypes of renal cell carcinoma. The renal clear cell carcinoma, the renal clear cell happens to be the most common of all renal cancer cases, accounting for over 70% of all renal cases. Molecular or targeted therapy and immunotherapy are the most recommended treatment strategy for clear cell kidney cancer. On the other hand, papillary cell types make up 10 or 15% of all renal cases, with localized types responsive to surgery, while metastatic types are often treated with immunotherapy. Sarcomatoid features, although not a distinct cell type of kidney cancer, indicate highly aggressive tumors that respond very well to combined immunotherapeutic strategies. Medullary tumors are and aggressive forms of kidney cancer types that are very, very common among the black communities, the black population. And chemotherapy happens to be the most recommended treatment option for medullary tumors. Collecting duct tumors are difficult to treat and often occur in children and the young population, generally speaking, while chromophobe tumors are rare and also very, very aggressive. Very, very aggressive. Although research is currently ongoing for the best therapeutic strategies for its treatment and management. Oncocytoma is another type of kidney cancer that is characterized by a slow-growing benign tumor, which often responds to surgery, while angiomyolipoma is a type of kidney cancer that is characterized by very slow growth and often it metastasizes, thereby spreading to different organs of the body. Now, what is the most common type of kidney cancer? Renal cell carcinoma, often referred to as the RCC, is the most predominant type of kidney cancer. It accounts for over 90% of all renal cancer cases. Renal cell carcinoma is characteristically heterogeneous, hence the reason for its various distinct subtypes. Renal cell carcinoma is more predominant among the adult population within 50 to 70 years of age. Renal cell carcinoma is 2 times more predominant in male than the female gender. Renal cell carcinoma is 96% sporadic and 4% familiar or genetic. Its common risk factors include, although not limited to this, smoking, excessive alcohol consumption, overweight, high blood pressure, exposure to renotoxic chemicals like trichloroethylene and chronic kidney failure. A study shows that low alcohol consumption, omega-3 rich fatty fish diet, and diet highly rich in and diet rich in fruit and vegetables prevent renal cell carcinoma. The World Health Organization classifies renal cell carcinoma into clear cell renal cell carcinoma, RCC, papillary RCC, chromophobe RCC, hereditary leiomyomatosis RCC, multilocular cystic renal neoplasm of low malignant potential RCC, acquired cystic disease associated RCC, tubulocystic RCC, clear cell papillary RCC, mucinous tubular and spindle cell carcinoma, renal medullary carcinoma, collecting duct carcinoma, succinate dehydrogenase, that is the SDH deficient RCC, and the mitochondria, that is the MIT family translocations carcinoma, alongside other unclassified types of RCCs by the World Health Organization. Now, what are the symptoms of kidney cancer? Now, symptoms of kidney cancer may include varicocele, which is the formation of pathological veins around the scrotum, I mean the scrotal sac, recurrent fever, weight loss, fatigue, high blood pressure, swelling, lumps, and hematuria, that is blood in urine. In our next episode, we're going to be talking about more about varicocele, and then we're going to be talking about varicocele in detail. We'll have a detailed analysis, I mean, detailed assessment, detailed uh, lecture on varicocele, because varicocele is a very, very important, I mean, very, very sensitive aspect that you just need to pay very cognizant attention, detailed attention to every aspect of the lecture, because we're gonna be keeping it aside to have a detailed analysis, I mean detailed expansion of the subject matter, so as to be able to drive home a very crucial point into you, so you can be able to understand what varicocele is all about, I mean in detail, because a whole lot of persons are expecting to, I mean, to father a child, but this hope has been dashed to the ground because of uh, unknown issues, and to them they've actually tried best by seeking various, I mean, different medical professional uh, uh, counseling, I mean, professional services, medical services, but to no avail. This has yielded no result. So I think it's very important expectant fathers that are finding it difficult to 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 father a child. I mean, take this aspect very, very seriously, because it may be the causative, I mean, the root cause of this, of the impotency that is being experienced by the person in question. So it's a very, very delicate aspect that we'll be talking about in the next episodes on varicocele. So stay tuned and kindly like, share, comment, subscribe to this channel so as to be able to get other videos that will be released subsequently, most especially that of the varicocele that shall be released soonest. Yeah, because varicocele is so key in the in the production of sperm. It is very, very key in it plays a very, very crucial role in fertility. Yeah, in fertility. So if you're having infertility as a man, it's very, very important you take this aspect very seriously, and then see how you can be able to listen, watch the next episodes of the video that will be released, so as to be informed, I mean furnish yourself with very, very this key important uh, uh, subject matter on varicocele. Is very, very important. Yeah, so recommend this channel to your friends, your loved ones, expectant fathers, who are actually looking for the opportunity to father a child. Yeah, we just recommend it for them, and just recommend it across, and they will get informed and see how they can be able to nip the problem they are, or the challenges they're currently facing, to the bud. Yeah, so right now we shall be talking about the classifications or staging of kidney cancer. Now, the staging or classification of kidney cancer is done using the TNM system. Yeah, that is T for tumor, N for number, and M for metastasis. Yeah. Now, this TNM system form the system that classifies cancer in stages, like the stage 1, stage 2, stage 3, and stage 4, based on the American Joint Committee on Cancer, that is the AJCC guidelines. You understand? So the severity determines the stage in particular. Yeah. So the higher the number of the stage, if it's stage 4, the higher the severity of the clinical case. Okay. So someone that is being categorized or classified as a stage 1 kidney clear cell carcinoma patient has a lesser severity I mean, it has a lesser severity of the clinical case compared to someone that is being classified as stage 4 renal clear cell carcinoma patient. Okay, so the number correlates severity. It commensurates the severity of the case at hand. Okay, so who is more likely to get kidney cancer? Primarily, anyone can get kidney cancer, but some factors are responsible for enhancing your chances of getting kidney cancer. So you may likely develop kidney cancer if you have a family history or a close relative who is suffering from kidney cancer. If you smoke, if you're overweight or obese, if you're suffering from high blood pressure, if you're having long-term dialysis for kidney failure, and if you are suffering from certain inherited genetic conditions such as tuberous sclerosis, that refers to a rare genetic disease that causes non-cancerous or benign tumors to grow in organs such as the brain, lung, heart, skin, nerves, eyes, and spinal cord. Okay, so what are the secondary causes of kidney cancer and the recommended therapies? The majority of kidney cancer cases are caused by renal cell carcinoma, which arises from the tissues lining the kidney's filtration units. Yeah, so lymphoma, which is a cancer of the lymphatic system, affects both the kidneys and lymph nodes and is better treated with chemotherapy. Yeah? Urothelial carcinoma, also known as transitional cell carcinoma, originates from the renal pelvis, and it constitutes a small percentage of kidney cancer cases. Okay, so sarcoma, a rare form of kidney cancer, develops in the bones and soft tissues uh, and is best managed with surgery, while Wilms tumor, which happens to be the most common type of kidney cancer in children, often responds very well to radiation and chemotherapy in addition to surgery. Okay, now how do you reduce the chances of getting kidney cancer? In the real sense, no one can actually prevent kidney cancer, but you can make healthy changes that can reduce your chances of getting it by hitting the gym or exercising often to lose excessive weight, quitting smoking, cutting down on fried foods, excessive salt intake, excessive alcohol consumption, and of course, caffeine consumption as well. So, thank you very much for your time. I look forward to seeing you all, meeting you at the comment section, hitting the like buttons, hitting the subscribe buttons, and equally coming over the subsequently to access the next cogent, important, and very, mind-blowing lecture on varicocele. That's going to be the subsequent of the next episode of our lecture. Thank you for your time. Thank you, and thank you all. Thank you.